today, inshallah, I'm going to talk about the role of health professions education in to achieve the Sustainable Development Goals. As we all know that the health was defined by the World Health Organization, the complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So if we have this definition and we link it to the Sustainable Development Goals, we can think that, or we find that it links to many of the Sustainable Development Goals. Maybe we can link them to the whole 17, because we are talking about people and we're talking about person. But mainly, it is linked to the goal number 3, which is the ensure health lives and promote well-being of all people. And this was translated by policies into the universal health coverage, which means 2 things. We mean that we need to have health policies, and we need to have health workforce, those people who can work towards giving health or preparing people for being healthy. So to achieve this universal health coverages, 2 guides were developed by the World Health Organization. There is the global strategy that Dr. Salia talked about, and also the National Health Workforce Accounts. And I'm going to present my talk based on the themes that came from those 2 guides. So those 2 guides, in relation to health professions education, they defined 4 themes. That we need to have graduated competencies that will help achieving the universal health coverage, social accountability, accreditation standards, and also financing of health professions education. And in a minute, I'm going to talk about each of those 4 themes. If we think about the graduate competencies and how can we apply this into Sudan, first, we need to have a national qualification framework. Now, we have different qualifications. We have diploma and higher diploma. We have masters and professional masters. And then we have PhD. And then we have MD Sudan. So what is the meaning of all these things? And what is the difference? And how can each qualification will lead to another qualification? And if we have a national qualification framework that will start from a Rauda till the end of the education. The other thing in Sudan, the qualifications come from different institutes. We have academic institutes belong to Ministry of Higher Education. We have institutes belong to Ministry of Health, but giving academic qualification, like the Institute of Public Health. We have institutes that belong to hospitals and produce health professions. So who is going to produce those people? We need to define it so we can have this national qualification framework. When we talk about the competencies, we need to think about that we are producing people to be employed to serve people in health. So we call it education for employability. It is not only about al-muqarrar, as Dr. Sheikh Babikir mentioned, it's about the curriculum, the manhaj. And this manhaj should not include only diseases, drugs, and treatment, but also communication skills, leadership skills, and all those things which help people to do their job. If we want to do this, then we need to look backward. What are they going to do when they graduate? And then we develop the competencies. But to define this, we need to resolve some of the conflicts we have. For example, we have radiographers and we have radiologists. What's the difference between them in doing the job? If we do not have these clearly mentioned and developed, we cannot develop the academic graduate competencies. And we all talk about interprofessional work, about teamwork. Then the competencies themselves should be interprofessional. We need to have competencies that link al-mumarrid with the doctor with technician. So when we develop those competencies, we need to work as a team. Again, as Sheikh Babikir mentioned, a team of health professions who look into the health of people. So these are the main things that we need to consider when we develop the graduate competencies. The second theme is the social accountability. And social accountability is the strengthening of the social contract mentioned by Dr. Abdurrahman. Social accountability in health professions education was defined as the obligation of the medical and health professions schools to direct their functions, which are education, service, and research, to the priority health concerns of the community. But who is going to define those health concerns? We are not the people who are authorized to define those health concerns unless we have the society with us. So we cannot just define those concerns on behalf of people. We need to sit together to define those health concerns. To be socially accountable, we need to have good partnership between the health professions education institutes, with Ministry of Health, with people, with all those are working in health, NGOs, so we can have this partnership to develop this social contract and to move it forward. We need to have the education fitting with the health system. So if we are doing our health system based on family medicine, then our educational should be based on family medicine. If we are based our health system on primary health care, then our education should be based on primary health care. So there will not be a discrepancy between the graduates that we produce and between the type of health professions that we need. So we will try to fill this gap. We need to think about Sudan's health profession curriculum, a curriculum that fits with Sudan. We don't need to import anything from outside. And we have experiences from other parts of the world. In Philippines, they have their own system. They have what they call the step-ladder curriculum, where students, they join the health professional school. If they spend 2 years and they want to leave, they will have a graduate as midwives, diet. If they spend 4 years, they will be nurses. If they spend 6 years, they will be doctors. So the doctor, when they spend 6 years, they can work as diet, as nurses, and as doctors. So they can fit everywhere in the Philippines. And also we have in Canada, they have the satellite medical schools. In Australia, they have medical schools that are devoted to the Aboriginals. So they teach them in the curriculum the language of the Aboriginals. And also we have in Iran, where they mix the health professions education with Minister of Health. So we need to think about our own curriculum that fits with Sudan, that helps Sudanese people to develop their health. And also we need to think about the acceptance of students and the community-based training. Who is going to join the medical school? Are they those only who can get 90% and above, and those who have the money? Those, they will not serve the community later on. I cannot say not all of them, but majority of them, they will not be able to go to remote areas. So we need to think about how can we recruit medical schools, medical students. How can we recruit the students for the health professions education? In 2011, we did a study about the distribution of medical schools in Sudan. We found them, most of them are in Khartoum, and those are in Al-Wilayat, they are in the big cities. So how can I train people in Khartoum and I want to send them to Kadugli? I want to send them to other places. They don't know even how can they live there. They don't know how to talk with people there. So we need to think about this balance. From where can we recruit the students and where do we train them so they can serve the community later on? The third theme is about accreditation standards. We need to think about the outcome standards. Accreditation should not be based on how is the shape of your buildings. How many rooms do you have? How many chairs do you have? Should be based on what is the outcome. How did you serve the community? And then accordingly you will be either accredited health professional education institute or not. We need to think about social accountability. How can the accreditation standards help health professions education to be socially accountable? And if they don't have this in the standards, they may not follow it. Accreditation should be for all professionals. Now we have a very good accreditation system for medical schools. 2 weeks ago, I was in Turkey, and they put the experience of Sudan in medical schools accreditation as an example for the world. But what about the nursing schools? What about the laboratory schools? We need to take them all together because doctors cannot work alone. They need all those people. So they have to be on the same level. Accreditation, we need to harmonize the curricula with the need of the country. We don't want to have one curriculum or one syllabus for all medical schools or for all nursing schools. But we need the accreditation to push them to be harmonized with the outcomes that needed for Sudanese people. And we need to think about the society that we are producing health professionals to serve the people. If we have all this in the accreditation system, we can have graduates who can really serve the society, and we can have health professional institutes who can really go to achieve the sustainable development goals for Sudan. The last theme, which is all people talk about, is the finance. When we talk about the finance in health professionals education, we need to think about that health professionals education has many different people to work with. Not all people who work in the health system come from the health professionals education institutes. We have people who come from science. We have people who come from mathematics, from الناس الإحصاء. هم ما بيدرسوا عندنا في health professionals education, but they are part of the finance system. Also, we have people who leave the health professionals education for a while and come back, especially women. They leave for 1-2 years and they come back. So when we graduate them, we need to put them put this in mind and put it in the financial plans for us. We need to think about the social return of investment and not only the return of investment. Nowadays, we have a lot of private health professionals education. It's right. No, it is not a sin. Again, they have to have a return to the society. It is not that we are accepting 100 students, we spend this amount of money, then we have to have a profit. Yes, you have your profit, but you need to think about how can you serve the society based on the profit that you are having. Because the land where your school is belongs to the country. And you have to pay for this. And also, whatever things we need to think about, practices we have, we need to think about socially accountable, cost-effective practices. Do we need a simulation lab? Maybe we don't, because we don't have a problem in patients. But we need to have another practice that help produce good graduates for Sudan health system. We are not, yes, we have people who migrate, and this is according to globalization, but from the beginning, how can they serve the health systems that we want for our people? And the stakeholders' involvement. We need to define them. Who are they? Stakeholders can also be, they are not only the people who can wear full suits and come and sit with us in the rooms. Maybe, as Dr. Abdullah mentioned, those people who work in Sharjah al-Hawadis may be a very important stakeholders that we need to take them with us, so we can think about how can we balance between the cost and the product that we would like to have. At the end, if you want to have universal health coverage, we need to have a sustainable workforce. And this sustainable workforce cannot be maintained unless we look back into the health professionals education system. How can we have it to fit with the health system that we need? So if you do this, we need to have medical schools or health professionals schools who can have a good partnership with all people, so our graduates will not have this confusion between shall I have a private practice to gain money or shall I have to work towards the public health, and then we can have this universal health coverage. Thank you very much.
بنحلم بفضاء أوسع، بنحلم بزمن أجمل، بلاد ميلاد، بلاد ميلاد.